Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the Public Health Weekly Update with data accurate through August 4th, 2022. What I want to do this week is do a little bit of house cleaning, I guess it is, and get us up to date on what's going on with the COVID-19 pandemic, the monkeypox outbreak, and the case of polio that's occurred in the United States. In terms of the COVID-19 pandemic, I want to focus just on the United States because we're seeing something a little bit unusual right now. If you look at 2 months ago, you can see that across most of the states, there were very few cases, mostly up in the New England area. A month ago, it was starting to get a little bit darker, but now you can see it's getting quite darker. I mean, more cases pretty much everywhere in the country, especially sort of here in the Southeast. So more cases. At the same time, if you look at hospitalizations, that dark blue line is those over 70. You can see that we're at the fourth highest peak we've ever had. So more cases, more hospitalizations, and yet over the past 3 months or so, pretty much a steady number of deaths. So cases are up, hospitalizations are up, deaths have been running pretty steady with over 1 million deaths to date. And so it raises two questions. First is, why are we seeing more cases but not more deaths? I think that probably has to do with the fact that most people at this point have some level of immunity. A study that was done by the CDC and I believe the American Red Cross concluded that about 83% of Americans have either vaccine or disease-induced antibodies. 2/3 of Americans are vaccinated. Many of us are both vaccinated and have had the disease. But what we do know is if you have some level of immunity, your risk of getting seriously ill is decreased. And you can see this when they compare unvaccinated versus fully vaccinated folks. The latest data from the CDC suggests that unvaccinated folks still have 6 times higher risk of dying than someone who's fully vaccinated. So what this tells me is that if there are more people who are immune, whether from vaccine or natural disease, we're probably going to see less deaths. What it doesn't tell us, of course, is what's going to happen. Is the virus going to change over time? Is our immunity going to wane? And so on. The second question it raises to me, I think, is this the new normal? We look at this and say, okay, now for 3 months, we haven't seen a significant increase in the number of deaths. Is this the new normal? Well, the truth is we don't know. It's clearly a different pattern than we've seen at any time since the pandemic began. But even if this becomes the new normal, I want you to think about something. 400 to 450 deaths per day would place it in somewhere between the 4th and 5th. So in other words, we're talking about a new normal being the number of people who die from stroke or cerebral vascular accident and chronic lower respiratory disease. In other words, one of the top 5 leading causes of death in the United States. If that's the new normal, we've got a tremendous burden on our healthcare system. So we're probably seeing more cases, but not more deaths because of immunity. We don't know whether it'll wane in time. It remains very important that people take protective action, most importantly, getting vaccinated and boosted. And a question came in this week, what's going to happen with subvariant specific vaccines? We don't know yet, but what's coming out from the FDA sounds like sometime this fall they're going to recommend a modified booster that will be more specific to the variant that we're seeing, sort of along the lines of what we do every year from flu, but we don't know. So right now, what we're seeing is a steady number of deaths in the United States, not at a good number, 400 to 450 deaths a day, increased hospitalizations in those over 70, the highest risk group for dying, and increased number of cases across the whole country. So we'll keep an eye on it. In terms of monkeypox, 26,000 cases worldwide, virtually all of them outside the areas that have historically had monkeypox, the so-called endemic areas. There have been 4 reported deaths outside that area, so a relatively low death rate, but again, a lot of people suffering. Look at where the cases have been. The United States leads the pack. unfortunately. And you can see this map showing that there have been cases pretty much everywhere in the world. The blue dots are the so-called endemic area where monkeypox historically has been. The orange or golden dots are in places that it has not traditionally been. In terms of the United States, we've had 6,000 confirmed cases, 1/4 of all the reported cases worldwide, but be a little bit cautious with that because obviously we have a more robust reporting system than some other countries do. It's been reported from every state except Montana and Wyoming. If you look at the weekly number of reported cases, it's way too early to tell, but it looks like it might be coming down. So we'll have to wait and see. We know that monkeypox is a disease that can be controlled by traditional public health methods, isolation, vaccination, quarantine, education of those at the highest risk groups. And then you can see the states are wildly different from each other. I believe right now Tennessee's had 39 cases. So monkeypox is evolving in the United States, evolving around the world. Again, it reminds us of the importance that if we do have the ability to stop a disease, we need to stop it everywhere because otherwise it'll be imported, it can be imported into the United States. And that's the next topic, which is polio. As many of you saw in the news, a man in New York State developed paralysis related to polio. It's the first case in almost a decade in the United States. It was caused by a type of polio virus from an oral vaccine that hasn't been used in the United States for over 2 decades. But it suggests that the man may have been infected in the United States. So again, as we've explained before, the type of vaccine that's used in the U.S. is a killed vaccine. There are live attenuated virus vaccines used in other parts of the world. They don't cause disease. Rarely they can. And that's what appears to have happened in this case. Fortunately, the majority of people who are exposed to any live polio virus don't develop paralysis, but some do. So some people have said, okay, does this mean that polio vaccines aren't effective? No, in fact, polio is one of the most powerful lessons in why vaccinations are important. That's the polio virus. The history of polio is no secret to anybody. Worldwide efforts began in 1988. At the time, there were 125 countries with polio. Now there are only 2. It's estimated that over 16 million children have been spared paralysis and 1.5 million deaths or more. Polio has decreased 99.9%, largely because of the use of an effective vaccine. So 2 take-home lessons this week. One is if a disease is spreading anywhere, it can appear anywhere. That's been the case with monkeypox and in the case of polio. But the second take-home lesson is if we know how to control a disease, let's go ahead and do it. Common sense approaches, public education, vaccine where possible, isolation and quarantine. We've added a couple of folks to our mailing list. Thank you for suggesting them. If you know of anyone else, if you share these videos with other people and they'd like to be on our mailing list, we're happy to add them. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And if you do have any questions about any of these issues that we've talked about, please let me know. I'll do my best to answer the questions either in next week's video or in a direct email back to you. So until next week, please be well.